Today we're going to discuss a relatively common skin condition called hand dermatitis, which is also known as hand eczema, including symptoms, what it looks like, as well as causes and finally treatments. Now, hand dermatitis is a common condition and it can affect about 1 in every 20 people. It can start in childhood as part of an inbuilt tendency to eczema, but it's most common in teenagers and adults. Now, hand dermatitis may be a short-lived problem, but in some people it lasts for many years and it can have a really big impact on their daily life. So let's start off this video with the signs and potential symptoms of hand dermatitis. So some of the symptoms of hand dermatitis include red, swollen and inflamed skin on the fingertips, finger webs or on the palms of the hands. Now, the exact nature of what it looks like is going to depend on your skin tone, but I've included some example photographs here to help you recognize it. Now, dry skin can also appear scaly or flaky, and it can lead to painful cracking, bleeding, as well as oozing of pus if it becomes infected. In some people, hand dermatitis may also cause itchy blisters to form on the palms of the hands as well as the sides of the fingers. Now, it's important to note that a different condition that is called psoriasis can also affect your hands, and whilst it can look similar to dermatitis, with psoriasis there is an increased likelihood of thick, scaly patches on the palms which look like the photos you're about to see on screen now. So now we understand a little bit more about what hand dermatitis looks like. Well, what are some of the potential causes? Well, there are several potential causes for hand dermatitis. The first is direct exposure to harsh chemicals and things that can irritate the skin on your hands, like soaps and detergents, or from frequent contact with water. And that's also why people who work in jobs that require them to wash their hands 10 or more times a day are more likely to develop hand dermatitis or hand eczema. So these jobs are things like healthcare professionals, so doctors, nurses, as well as cleaners, beauticians, and chefs. Now, the second potential cause is an allergic reaction to a particular substance like perfumes, rubber, or leather. Now, this is called contact dermatitis, and it's where the irritating substance comes into direct contact with the skin on your hands and then it causes the skin to flare up. Finally, it is possible that the exact cause of hand dermatitis is not known. So how is hand dermatitis diagnosed? Well, typically hand dermatitis can be diagnosed from simply looking at the skin on your hands and your doctor asking you some questions about your symptoms and your job. However, if you think you have hand dermatitis, you should always consult your health provider because they may use a skin patch test to help determine if you're having an allergic reaction to a particular substance. This is going to be really helpful because it can then help you to avoid this substance in the future moving forward. Finally, let's discuss some potential treatments. Well, there are several different treatments that might help manage the symptoms. However, in most cases, the treatments don't cure the underlying cause of the dermatitis. Now, one treatment option, especially for mild cases, are hand moisturizers. These can help lock in the moisture of your skin, helping to repair and soothe the damaged skin, whilst also helping to protect the skin from bacterial infections. Now, one product that I can really recommend personally are Nursum hand creams, which were specifically developed by a nurse in the NHS, and I've included a link in the description box of this video where you can find these. Now, this video is not sponsored in any way by Nursum. I just personally have used these creams and found them to be really helpful and really good. Now, the other treatment that might be prescribed are steroid creams or ointments, but these should only be applied to the skin up to twice a day to avoid the risk of skin thinning, and they should also be used for the shortest amount of time possible because long-term use of steroids can lead to potentially negative side effects. Now, the other option that we could possibly discuss are topical calcineurin inhibitors. These can come as creams or ointments, and they can be used as an alternative to steroids, and although they may not be as effective as stronger steroids, they don't carry the risk of skin thinning. Now, there are other forms of treatment for severe cases of hand dermatitis, and these are things like ultraviolet or UV therapy, steroid tablets, as well as medicines that suppress your body's own immune system, but these are usually only reserved for cases where all other treatment options have failed. Now, in many cases, the old adage of prevention is better than cure is really true for hand dermatitis. You might be able to prevent hand dermatitis in the first place, by doing things like wearing gloves when you're in contact with harmful chemicals or in situations that need frequent hand washing. The other thing to note is that proactively using a barrier cream or a moisturiser may help to reduce the risk of developing hand dermatitis, so it's really worth speaking to your pharmacist about good moisturisers or creams that you could use. I've included lots more useful information in the description box of this video for you to check out in your own time, and if you've got any other top tips to help others, please do share them in the comment section below. Thanks for watching, and until next time, bye.